19. Taber's Cyclopedic Medical Dictionary. Continue. Pregnancy. Patient care. An essential component to anticipatory guidance and patient teaching is to encourage the woman's active participation in her own health, maintenance, and pregnancy progress. Health care providers describe to pregnant women common complaints related to normal physiological changes of pregnancy and suggest actions to minimize discomfort, disorder, nausea, and vomiting. See morning sickness. Heartburn, hormone-related delay, gastric emptying, cardiac sphincter relaxation, and stomach displacement by the growing uterus contribute to reflux. The use of the low sodium or combination aluminum hydroxide magnesium hydroxide preparations is recommended for symptomatic relief. For severe unresponsive heartburn, over-the-counter H2 hydrogen blockers, over-the-counter H2 blockers, such as ranitidine, Zantac, or famotidine Pepsid, may be recommended. Constipation. The woman should increase fiber and fluid intake. She also may use stool softeners. Muscle cramps. The woman may relieve to so-called Charlie horse that occurs during sleep by dorsiflexing the foot of the affected leg. A calcium-phosphorus imbalance may contribute to increased frequency of this problem. The woman can increase calcium intake by drinking the recommended daily quart of milk or by drinking a pinch of milk daily and taking a calcium supplement. Back pain. Growing anterior mass, shift in center of gravity, and increased lumbar curve contribute the backaches. To relieve discomfort, the pregnant woman should wear well-fitting low-heel shoes and perform exercises that increase abdominal muscle tone. See pelvic rock, pelvic tilt. Dependent edema. Pedal edema is a common third trimester complaint related to decreased venous return from the extremities. The woman is advised to rest frequently and to elevate her feet. She should report promptly any edema of the face, hands, or sacral area to facilitate early diagnosis and management of pregnancy-induced hypertension. Varicose veins. Decreased venous return from the extremities and compression of vascular structures by the growing uterus aggravate any weakness in the vascular wall. Varicosities often occur in the legs, vulva, and pelvis. The woman should avoid tight clothing and prolonged standing. Other preventive and therapeutic measures include wearing support stockings, resting in left seams position, and elevating the lower limbs during sleep. Hemorrhoid, temporary Symptom relief may be obtained by sitz baths and analgesic ointment. The woman also should be instructed in how to reinsert the hemorrhoid with a well lubricated finger, holding it in place for 1 to 2 minutes before releasing the pressure. See constipation, vaginal discharge. A normal increase in vaginal discharge occurs during pregnancy. Common perineal hygiene usually is effective as a comfort measure. Douching is contraindicated during pregnancy. The woman should contact her primary caregiver promptly if profuse, malodorous, or blood-thin discharge occurs. See vaginitis. Dyspnea, shortness of breath, occurs as the growing uterus presses on the woman's diaphragm. Elevation of the head and shoulders may provide some relief. The dyspnea disappears when lightening occurs. Pruritus, the normal stretching of the skin may generate itching on the breasts, abdomen, and vulva. Use of an emollient lotion may be suggested. The patient is instructed to inform her primary caregiver if vulvovaginal itching occurs in conjunction with an increase or alteration in vaginal discharge. See vaginitis. Nutrition. A woman's nutritional status before and during pregnancy is an important factor that affects both her health that of her unborn child. Nutritional assessment is an essential part of antepartum care. In addition, the presence of pre-existing and coexisting disorders such as anemia, diabetes mellitus, chronic renal disease, and phenylketonuria may affect dietary recommendations. Substance abuse increases the risk of inadequate nutrition. Low material weight gain, low birth weight infants, and perinatal mortality. Dietary recommendations emphasize a high-quality, well-balanced diet, increased amounts of essential nutrition, example protein, calcium, magnesium, zinc, and selenium, B vitamins, vitamin C, folate, and iron are necessary to meet the nutritional needs of both mother and fetus. Most nutritional and metabolic needs can be met by eating a balanced daily diet containing approximately 35 kcal for each kilogram of optimal body weight, plus an additional 300 kcal per day. During the second and third trimester, vitamin supplements are not required if the woman adheres to the dietary recommendations. However, daily and iron supplements are recommended. Considerations. Travel during pregnancy. Preparing for travel during pregnancy will depend upon the number of weeks gestation, the duration of the travel, and the method. Example: auto, boat, bus, train, airplane. Safety belts, preferably the combined lap and shoulder type, should be worn. If nausea and vomiting of pregnancy is a factor, travel by sea isn't advisable. If anti-motion medications is used, it should be approved for use during pregnancy. Travel during the last part of pregnancy isn't advised unless obstetrical care is available at the destinations. It is important to have a copy of current medical records along when traveling. Travel abroad should be discussed with the obstetrician so that appropriate immunization can be given. For travel in an area known to be endemic for malaria, certain drugs will be needed for prophylaxis. Caution: not all antimalarials are safe for use during pregnancy. Live virus immunization should not be administered during pregnancy. Working during pregnancy: healthy pregnant women who are employed in jobs that present no more risk than those in daily life are encouraged to continue working if they desire until shortly before delivery.